What does Paget's disease do to your bones? Have you ever wondered how Paget's disease affects your bones? Paget's disease of bone is a chronic disorder that disrupts the normal process of bone remodeling. Typically, old bone tissue is gradually replaced by new bone tissue. However, in Paget's disease, the body first loses bone faster than it forms new bone. As the disease progresses, new bone is produced at an abnormally rapid rate. Unfortunately, this new bone is not like normal bone. It is structurally disorganized, larger, weaker, and softer. This leads to bones that are fragile and misshapen. The disease most commonly affects areas like the pelvis, skull, spine, and leg bones. Because the new bone is poorly organized, affected bones can become enlarged and deformed. This can cause bone pain and increase the risk of fractures from minor injuries. You might also notice deformities, such as bowed legs. The abnormal bone growth can put extra stress on nearby joints, often leading to secondary osteoarthritis, particularly in the knees and hips. In the skull, Paget's disease can lead to an enlarged head, hearing loss, headaches, and dizziness. When the spine is involved, it may cause nerve compression, resulting in pain, tingling, numbness, or abnormal spinal curvature. The weakened bone structure may also lead to complications such as pinched nerves and fractures. Overall, Paget's disease results in bones that are larger but structurally weaker and more prone to deformity, pain, arthritis, and fractures. Treatments often include bisphosphonate medications, which are also used to treat osteoporosis. These medications aim to strengthen the bones and manage symptoms. However, some complications may require surgical intervention. From the perspective of osteoporosis, which also involves weakened bones and an increased risk of fractures, Paget's disease shares the feature of compromised bone strength. However, it differs in that it involves abnormal bone remodeling with excessive, disorganized new bone formation rather than primarily bone loss. Both conditions highlight the importance of maintaining bone health to prevent fractures and deformities. If you have concerns about bone health, it is always best to consult with a healthcare professional for personalized advice.